Like a lot of Texans, I love to travel, but my eye isn't just on the destination. I value every step on the pathway that brought me to who I became today. This is a look at just a few of the steps taken along that journey. For me, the journey began as a 23-year-old, freshly licensed attorney, determined to become an effective advocate for the victimized. I could never have predicted that ultimately the journey would take me from the legal representation of the victimized to the clinical service of the severely traumatized. I've served the last 22 years as a federally registered healthcare provider to patients, as a medical and clinical instructor, as a director of healthcare foundations, and finally, as a special consultant to the Pentagon and the Army Central Command, serving our warriors at the battlefield in Iraq. Today, as one of America's only dually certified medical and forensic traumatologists, I am proud to serve as the Chief Executive and Clinical Director of MediMental Care, a highly specialized practice that is like no other. Our practice is devoted to the treatment of serious traumatic stress injuries resulting from catastrophic occurrences and accidents, using proprietary methods of care that are legally, medically, and mentally well-informed. Traumatic stress injury isn't the mental problem that people think it is. It is a true physical injury to the brain and central nervous system. It is a constant companion of traumatic brain injury, but in addition, it is a serious injury in its own right, capable of causing over 24 different kinds of downstream health conditions, ranging all the way from those that threaten health to those that threaten life. We specialize in using highly advanced, objective approaches to TSI, approaches which make it measurable, imageable, and highly understandable.
I can tell you firsthand that she has been instrumental in literally saving the lives of several of my patients that have had traumatic injuries, that suffered with post-traumatic stress disorder, suffered with bouts of depression. If it were not for her keen sense of awareness, her clinical acumen, and the heart that she brings to a clinical situation, I believe that those patients would not have endured their illness and their recovery. I know that she will carry the weight of her specialty with absolute precision and absolute professionalism. She is really an absolute joy to work with as an expert and as a traumatologist.
And when the need arises, and we are called upon to do so, we testify in courts of law in ways that make the complexities of traumatic stress injury understandable and relatable, and which explain why the costs of comprehensive treatment are justifiable. If you have suffered a serious traumatic injury, call us as soon as you are able, when our clinical program can be of most benefit. Please visit us at MediMentalCare.com. Our journey of care can lead to a patient's journey of recovery.